We're going to do another test that's going to verify and confirm category 2. It's called cervical compaction test, okay? So we want to make sure we're differentiating between a pelvic major and a cervical major. There are times when the cervical spine can create a positive category 2, and then you have to deal with that. But let's just explain the cervical compaction test. What we're going to do is have FJ, we'll slide you back a little more, FJ, center his hips on the block. So what I'm going to have him do, what I'd like you to do, FJ, is a 6-inch leg lift with both of your legs, and you can set them down. Okay. Now if a patient can't do that, they're definitely a category 2. If they just can't do it, I mean, you're pretty much rest assured they're a category 2. Now what I'll have you do is raise your legs again and kind of take note of the effort in your mind and relax. Now what I'm going to do is I'm going to gently compact the cervical spine. Essentially, don't raise yet, FJ. Essentially, when I'm compacting the cervical spine is I'm stabilizing the cervical spine. And if it were an issue with the cervical spine, through stabilizing the cervical area, if when he raises his legs, it feels easier to him, it would be a cervical major. So if I compact the spine, now raise your legs, FJ. And if it were to have gotten easier, you'll ask the patient, was that easier or harder? And if he says it was harder, that's category 2. If it's easier, you have to address the cervical spine first, and you probably have an underlying category 2. But you have to make sure that this is just confirmation. It's not only confirmation for you, it's confirmation for the patient. Patients like to know that you know what you're doing, okay? So it's important that you demonstrate that to them. So the idea is, by compacting the spine, and when the patient raises their legs, if it gets easier, it's cervical major. If it gets harder, we confirm category 2. Because by stabilizing the cervical spine, we've isolated the weakness or the lesion in the pelvis, okay? So that's cervical compaction test. You can get really in-depth with SOT. It's probably one of the most clinically demanding techniques that you'll ever study. You can go so in-depth with this stuff. It's amazing. Beautiful thing about it is it's all based on patients' physical findings. What you're going to tend to find with category 2 is involvement with the inguinal ligament. You'll tend to find nodules, and you just tell the patient we're palpating along the inguinal area. You'll find tender, palpable nodules along the inguinal ligament. The inguinal ligament is the major proprioceptive feedback mechanism for the pelvis back to the brain to let the brain know where the body is in space. And with the weight-bearing issue, you distort the tone of the inguinal ligament. Poupart's ligament is another name for it. Anyway, the other test that we do to confirm category 2 is called the arm fossa test. I'm just going to show you how to do it. You can read up on it, get more detail about it. But the arm fossa test is a test of reaction. I'm going to have the patient with his eyes open, hold his arm straight. It's just a test of reaction. There are 4 fossas, an upper and lower, on each inguinal ligament that we're going to, as I say hold, I'm going to check for reaction. As I say hold, I'm going to touch with 4 fingers along the inguinal ligament. Can you see that, Hillary? 4 fingers along the inguinal ligament. I'm going to say hold, touch, and then I'm going to say hold, touch, and I'm looking for hesitation. That's confirmation for category 2. So I'm just going to run through it. You can get an idea of what I'm doing. You always start on this side of the table, the left side of the table. You move in a clockwise direction for polarity. Ready? And hold, and hold, and hold. He's strong. He's actually not a category 2. We're just faking all this today. Okay. Ready? And hold, hold. And you can see I'm not doing this. Okay? It's not about this. It's just here, here. It's subtle. A lot of chiropractic is subtle. Ready? And hold, hold, hold. He is strong. We don't want to block him category 2 today, but if we were to do it, you do it according to short leg in the supine position. Can you see this, Hillary? Okay, we'd evaluate the leg check, and we'd want to take all the plantar flexion out, and we'll make it look like a right short, and there it is, okay? A right short. So that means FJ is going to have a posterior ilium on the right, his right leg is posterior. His left is anterior. So we're getting a shearing effect of his ilium on sacrum, okay? disrupting his weight-bearing potential. So let's pretend, stay right there, FJ. This is FJ without his skin. We've got a posterior ilium on the right. So we're going to place the block on the board halfway. The crest of the ilium, the superior aspect of the iliac crest, is going to be halfway on the block. Half of the block is under the lumbar musculature, and the other half is in contact with the ilium, perpendicular to the spine. On the anterior side, we're coming up through the ischium, angling. Okay, so that's the block placement. That would be the block placement. Simple. Fulcrums. This ilium is posterior. We place the block here to work it anterior. This pelvic bone is anterior. We place it here to work it posterior. And because the blocks are sloped, it's going to bring the articulation together at the weight-bearing portion of the sacroiliac joint in the posterior. Okay? That's how it works. While they're on the block then, place the blocks, then you're going to do your arm faucet test again. Hold, hold, and you want to see them build. You only leave them on the blocks as long as it takes for the arm faucet to build. Usually 45 seconds to 1 minute. This is not a long blocking procedure. This is powerful stuff. Ready? Hold, hold, and once they do that, you're good to go. Once it builds and it's strong, we pull the blocks evenly, and then we're good to go. There's some psoas involvement possibly. You'd want to clear out hypertonic psoas musculature. Iliacus and psoas work together. There's techniques for that, which we can touch on later in a separate lesson. That's it on category 2.